Yes, feel free to download these or currently or later or for later on for your own reference. All right. So these are our two agendas. First, we're going to perform an analysis using the Harmonized CHARLS. And secondly, we're going to be doing a cross-country analysis using the Harmonized CHARLS and the RAND HRS. So our first analysis, we're going to pose the research question, which is, are there gender differences in cognition? And are those differences consistent across all age groups? So do we see differences using some kind of summary of cognition or cognition measure between males and females? And then are those differences between males and females different for different age groups? This is research that's actually already been done that we're basing it on. And it's this paper by Lei, Smith, Sun, and Zhao called Gender Differences in Cognition in China and Reasons for Change Over Time, Evidence from Charles. And that was in the Journal of Economics and Aging, Volume 4, December 2014, which I'd encourage anyone to check out. All right, so our steps. So the first step that we're going to do is we're going to create the Harmonized CHARLS dataset. We will identify relevant variables. We're going to create any additional variables that we need for our analysis. We're going to apply our weights. Weights are often something that is confusing for people who are just starting to use these datasets. So that's helpful. And then we're going to analyze cognition across genders. And then sixth, we're going to analyze cognition across genders and ages. So to begin with, we're going to create the harmonized dataset, the harmonized CHARLS dataset, and to be in particular. So first, we're going to download all CHARLS data files for Wave 1 and Wave 2. We're going to download and run the harmonized CHARLS creation code in Stata. And then we can also download the Harmonized CHARLS codebook so we have documentation, so that we understand the data set that we're using. So let's go back to our website, and we can stay on this download tab here at the top from download data and more. And then you can see here for CHARLS, we have linked to download survey data. So I'm going to follow this link here if you haven't done this. You will also need to sign in if you haven't for the Harmonized CHARLS. And what we're going to download is CHARLS. What's required here is CHARLS Wave 1, and that's their baseline from 2011. And we'll download all data in one zip file, including household. And then we're also going to download the 2013 CHARLS, which is Wave 2, and then again we're going to download the entire data set in one zip file. And I would suggest storing these on your computer in some kind of way that makes sense and is kind of clean. I'll show you, for instance, on this computer in C drive, I have a folder called CHARLS, and I've stored all of the Wave 1 files here in CHARLS Wave 1. And then I've got all the Wave 2 files here for Wave 2 of CHARLS. So now that we've got all of our raw data, let's go back to the gateway and to our downloads page. So that's our first step. So secondly, we're going to download and run our Harmonized CHARLS data code. So if you click on this here, this provides some brief instructions about how to do this, but I'm going to walk you through it also. So we're going to download the Harmonized CHARLS data creation code. This is version B of the Harmonized CHARLS, which uses data from Wave 1 and Wave 2 of CHARLS. So we can download it. We can open it directly with WordPad or with Stata. In this case, let's just open it with Stata because we just want to run it, assuming we have all our files. I'll pull this over. So this is what it looks like. You're going to get a file called hcharlslong, and it's well named. It's quite a long file. And then you only need to edit these three lines, 12, 13, and 14. And you just need to list. Hold on. We just need to list the location of this data. So let's list for CHARLS Wave 1. Hold on 1 minute. Let's open that up one more time here. Okay, so for I'm going to list our dataset location for Charles Wave 1, and in this case I'm going to open this up. I think I'm saving this to a folder that won't let me download it. So let's just open it up using UltraEdit, which is the text editor. You can use this or the any Charles. Any text editor that works with data. So we're going to, again, edit lines 12, 13, and 14. So if you recall, the Wave 1 files were in a folder in my C drive called Charles Wave 1. Wave 2 are in a C drive in a folder called Wave 2 Charles. And then you have this, in line 14, you have output, which is where you want the Harmonized Charles to be saved. And if you recall, I created a folder in my Charles directory called Harmonized. So that's where I'm going to save. Once this is done, we're going to save it there. So once I've edited these 3 lines here, this is in downloads here. Okay, that's perfect. So let's go back into our Stata window. If you open it directly in Stata and edit it, you could just click Run. In this case, I'm gonna click File, Do. And we'll go to our downloads, and there's our download called Charles Long. So we can open it, and it'll start to run automatically. So what it's doing is it's using all of this pre-written code that we've developed here at our center to create a harmonized version of the Charles, which is easily harmonized with other harmonized datasets and the RAND HRS, which we're going to talk about the RAND HRS a little longer. So this will run on its own. I think it takes around 2 minutes to run. So while that is finishing running, let's go to our step 3, which is download the Harmonized Charles codebook. And for all of our harmonized datasets, we provide codebooks to let you know exactly how things were harmonized and how they were made. They are also available on the download tab of the Gateway to Global Aging Data, assuming that you are logged in, once you have a user account and are logged in. So we can download the Harmonized Charles codebook here. And this can, so we can say, well, let's save this file. So once we have that, and we can open it up, and briefly, we can just look at that. So here's the Harmonized Charles documentation. It's a PDF here because it's quite long. And you can see we also include bookmarks. So if you want to jump to a particular section, like say if we're going to be using health, we're actually going to be using cognition, which is section D. And you can see we have some total recall summary scores for cognition that we'll be using. So we'll be referencing this a little later on. So let's check in on our Stata code. And it looks like it just finished. And you can see that it saved it. It saved a file called hcharlesdta, exactly where we specified in our harmonized folder inside of the Charles directory of C drive. So this is kind of a thing that you have to do once. And now that you have this data set, you don't have to rerun this data creation code again. It's just a one-time thing. And this is the version B of Charles, which has both the 2011 wave and the 2013 wave, so wave 1 and wave 2 of Charles. All right, so we've got those first couple of steps out of the way. So our next step was to identify relevant variables. And our year of interest in this case is Charles 2011, which is Charles wave 1. And if you recall, what we're going to be looking at, what our research question was, is we're going to look at cognition by gender and age and look at those differences, whether there's a consistent gender difference across ages if there is a gender difference. And we also need an analysis weight. So we really only need about 4 variables here. So we need a measure of cognition, a gender identifier, an age identifier, and an analysis weight. So if you are new to this or you're doing a different topic, you might wonder, where could I find these? And where you would find these would be, the easiest way to find these would be using the concordance on the Gateway to Global Aging data. So for instance, here's our concordance. We could select Harmonized CHARLS. We can select, we're going to be using year 2010, 2011, which is wave 1 of Harmonized CHARLS. And the things that we need are age at interview. We need an analysis weight. We're going to be using cognition, and in this case, we're going to be using a summary score of cognition. I'll talk more about this. So a summary score of cognition. Let's see if I can. We'll leave that off for now. So we're going to be using age at interview, an analysis weight, a gender, and our summary score of cognition. And so we can search these. And then we could add any of these to our cart if we wanted to save them for later. Oh, we also, I think, forgot to select just the Harmonized CHARLS. So Harmonized CHARLS 2010, age at interview, gender, and analysis weight is what we're going to be looking for here. So let's search that. There we go. So it looks like the first thing we got here on our results page is a couple different analysis weights for Harmonized CHARLS. For any of these, you could click into them to see more what they mean, or a great thing to do is to check the code book. So let's just switch over to the code book. I think it's a kind of a great place to figure out differences. So let's go up and in section A, we're going to look at person level analysis weights. So you can see here we've got quite a number of different analysis weights. We've got an individual weight without non-response adjustment. We've got, this is a spouse version, then we've got an individual weight with household non-response adjustment, and an individual weight with household and individual non-response adjustment. And we want to account for this non-response. This is important if we're trying to make an estimate for the entire Chinese population. We need to account for this non-response. So the weight that we want to use here is this WTRESPB. You can also find more information here in the how constructed about how each of these weights, what values are stored in each of these variables. So let's see, here we go, R1 WTRSEP. And in this case, I'm just going to add this to my cart just so I have it. We'll also take an age variable, R1 AGY. It's the age in years. And there's our gender variable. And then we also need to add a cognition variable, which I'm just not able to add right now. But you can see here we have a list of different cognition questions. So once we have that, and you can, for the cognition variable, why don't we go back to cognition in our data set, in our code book. Cognition, of course, has its own section, and then we're looking at a total recall summary score. And this is going to capture episodic cognition. Charles has a set of questions called immediate and delayed word recall, and these are their own separate measures. So you could look here at immediate word recall also. And in the how constructed, we find out that Charles included a recall list of 10 different words which were read to a respondent, and then the respondent was asked to recall them immediately and later on in the survey. So they're asked to recall them 2 different times. It's about 4 minutes apart in the average survey. And then these 2 measures, how many words they were able to recall correctly immediately, and then 4 minutes later after answering some other questions, are combined to create this total recall summary score. So this is a summary score for total word recall, and it sums immediate and delayed word recall. We can see it has a range of 0 to 20, and that's because there are some people who recalled none of the words either immediately or delayed, and some people who were able to recall all 10 words both immediately and delayed. You can see we have a mean here of, for wave 1, the 2011 wave, for 7.25 for our respondent. All right, so we know what our relevant variables are, and we have our data. The next step is we might want to create some additional variables. And in this case, this is going to be quite quick. We're just going to create a 5-year age category. And to do this, you can see I have this data code here on the slide, but this would be also where we might want to go ahead and use our downloaded data code. So if you've downloaded that data code, again, I will just remind you where that is. If you go download data and more, and under recent presentations, actually our current presentation, we have webinar part 1's data code. So we can download this file here, and we'll just save that. And we'll download this file here, and we'll just save that file. So now if we jump back into Stata, we can say file do, and we're just going to use this file from here on out. We're going to be using part 1 here, which is the Harmonized CHARLS. So let's just open this up. So the first thing that we do, I'll say briefly just in case you're not sure about how this works. So Stata has pauses built in, which are helpful for showing examples like this and for checking your own work. So I've set pauses in after each step of this, and to step through the pause, all you need to do is type Q and press enter in the command window of Stata. So the first thing we do here is we just check our cognition variable, that one that we looked up in the Harmonized CHARLS codebook. You can see we've got our range here, and we've got the same mean. It's for 14,000 observations. So we can press Q and jump to our next step, and then we're going to check our gender variable, which was RA gender. You can see we've got about half and half, male and female. Looks like we're missing one report of gender, and then we have a couple people who are missing or refused gender. So we have that. Let's step through again. We're also going to check our age variable. So the mean age in this for wave 1 of Charles was 58. And you might want to remind yourself that Charles, what were the ages that Charles looked at? And one of the good places to do that is on our Surveys at a Glance tab on the Gateway to Global Aging Data. So we have Surveys at a Glance, and then we have a study overview. And this is kind of helpful because a lot of studies look at somewhat different age groups or things like that. And so on this tab here, the study overview tab, we can see that Charles looked at China, and age eligible was 45. So it started looking at people aged 45. And then you might also want to pay attention into, so spouses were included, and we let you know that they were included regardless of age. So that's interesting, right? Because we can see that we have people in here who are 21, 22, 25, some really young ages, and that's because they were spouses of people who were 45 or older, right? So who met the requirements. So that seems okay. And our average age is 58.69. That's not weighted in this case, that's just the average. And let's step through to the next step. And here we're going to create our age categories. So picking back up where we were before. And we're going to do this with the egen command. I'll jump back to the slide so you can see this kind of larger. So we're going to create a variable called R1, because we're still using wave 1 here, age categories, and it's going to be based on our existing variable R1 AGEY. And we're going to make our cut points at starting at age 45, so anyone aged 45 to 49, anyone aged 50 to 54, 55 to 59, 60, 65. And then we kind of top code that last category at 110, just to say anyone, there's no one, as we recall, who's older than 110. The oldest person in the Charles data is 101. But so we use 110. We've also specified this label option, which is helpful just to say, it just provides labels so we can know exactly who we're referring to, as we see here in our tabulations. Okay, so we've got the additional variables we need. That's great. So next we're going to apply weights. And weights are something that people have a lot of questions about, especially because every one of these surveys provides slightly different weights. And really the best place to get information about weights is to use those harmonized code books. So I'd certainly encourage you to read the code book. We generally include a lot of information as much as possible about how the weight was derived. The weights are also the weights that were taken from the original data. So in this case, this is a weight that was derived by the Charles team. And so we're going to apply this weight, and we're going to use it using the svyset command, which if you're not familiar in Stata, this is one of the reasons that Stata is often used to look at survey data, and particularly survey data that has complex sampling. So this svyset command is quite helpful. So we can kind of set the parameters for how we want to weight and treat individuals in the data using svyset. And in this case, we're just going to say svyset, and we're using a probability weight is equal to our weight variable, which is R1WTRESPV. Let's see, we have one question here. This is from Amit Kumar, and it says, I have a question about the variables. I'm a physical therapist, and I'm interested in gait and balance outcomes, such as Berg's balance and dynamic gait index. Thanks for your question, Amit. And I'll talk about maybe at the end some other variables. I think a good place to go to look for them. So gait is something that's measured in a lot of these surveys. They often have a biomarker section, and it's one of the powerful things about these surveys. But if you go to that concordance page, as I showed before, you can start to look for what gait and balance measures are available for which studies. Currently, I'll also say that they are not currently available. Gait and balance are not currently available in the harmonized data sets. You'd have to go to the original data. But you can search, I'll just jump back to the concordance tab on the Gateway to Global Aging data. So while you can search the harmonized studies, you can also search the raw data. So for instance, you could look for Charles, wave 1, and just search for gait. And you'd be able to find any gait items there. It looks like we're not finding any. It could be that we're using the wrong keywords. You can also select from some of these broader categories down here, or you can browse a survey using the surveys at a glance, and for instance going to Charles wave 1, and then you can see here we have a biomarker module. So you could go through the biomarker module and see what kind of questions are asked and what it's a hand strength measure, different kind of measurements like that. So I hope that answers your question. All right, so now that we've applied our weights, let's jump back into Stata and actually do that. Again, we'll do that by using Q. So we'll jump through. So we've applied our weight. This is also a great time if there is complex sampling design, as there is for most of these surveys. It's not a completely randomized sample of individuals across the whole country. This is a great place to set your cluster or strata variables if they are made available. And in the case of Charles, they're not part of the Charles download, like currently available data, public data. So we just want to be careful of the standard estimates which are produced from any analysis that we do, because we haven't accounted for that clustering and stratification. But our estimates should be, so our point estimates should be fine. Okay, so we've applied our weight in this case, and then we're going to analyze cognition across genders. So we can estimate mean cognition for males, and then we'll estimate it for females, and then we can test whether these two estimates are significantly different. So in this case, we're kind of analyzing just by looking at the mean. The paper which this is based on, and any serious analysis would probably also start to take into account other factors. It would look at, in particular, the paper looked at education and region as ways to explain some of these differences, which you would of course want to do, but this is just a simple example analysis. So the first thing we're going to do is we're going to estimate mean cognition for males, and we're going to do that using this command svy, subpop, and we're going to define our subpopulation as if our gender variable is equal to 1. If you weren't sure about the codes of gender, of the RA gender variable, this would be a great place to go back to the harmonized dataset and to look at that, the harmonized codebook, and look at how we define different values there. And then we're going to get a mean estimate for our cognition measure, for our summary episodic memory measure. So mean R1 TR20. And so this SVY at the beginning kind of recalls to Stata all of the weighting or complex sampling design that we set at this previous step, svyset. So this just says, you notice we don't have to specify here which weight we're using because it's recalling what we've already told it. So let's jump into our Stata window and we can type Q. And what you're going to see here is this large enough for people to see? Let me know. Someone type in the chat or questions too if this data screen is not showing up as large enough on your screen. But I'll walk you through what it says also. So we're going to estimate, first we estimate the mean for just the entire population. So it looks like our mean is 7.4288, and that's a weighted mean. That makes sense. That was what we saw before. And then we can type Q, and we can estimate cognition just for males. So just looking at just for males, we can see that we have a mean of 7.5296. And we've set this looking at just for means using the subpop option of the svy command. So we say subpop if RA gender is equal to 1, which is if you are male. And then let's jump to our next step, which is let's estimate mean cognition using this episodic memory summary score for females. And so if we do this, we can see that we get using females, so svyset subpop if RA gender is equal to 2, and to get our mean, we can see that our mean is 7.33, which does seem like a little bit lower, right? If our mean was 7.529 and 7.338 for females. And so what we might want to do is test whether these two are actually significantly statistically different. And we can do that using the over option on a mean estimate. So we can type SVY. In this case, we're not going to specify a subpopulation. We're going to use the entire population, but we're going to do it over RA gender. So we'll type Q here. So we can test the significance of of the difference. So you can see, so first we estimate cognition. You can see here we get these two numbers that we saw previously for males 7.529 and for females 7.338. And then we can test, this is an adjusted wall test to test the difference in significance. So we test, you use kind of the code here. We say this is how you run a wall test off of the mean estimation. So we can test, this is the variable that we're basing the estimate on for subpopulation 1. We're going to test whether it is equal to the estimate of this variable for subpopulation 2. And when we do that, you can see that we get a probability of 0.035. So it is significant at a 5% significance. So it seems somewhat significant that there is a real difference, which is interesting. And then lastly, for this part 1, we wanted to analyze cognition across genders and ages. So we want to see, is this difference that we're kind of seeing for sure between males and females, is it different for, say, the youngest cohort, which would be people who are 45 to 49 versus everyone who is 75 or older, if you remember how we defined our age categories. So we can test this difference, and in this case, this is also where Stata has very succinct code, which is nice. So we're going to estimate the mean cognition for each gender age group, and all we have to do for that is just add one more term to our over condition. So we're going to type SVY. Let's just recall our weighting. We're going to estimate the mean of our episodic memory summary measure, R1 TR20, and we're going to do that over gender and our age categories that we made. So when you do this, you can see the resulting code here. First, state to let you know what each subpopulation means. So in our results here, subpopulation 1 is referring to males who are 45 to the next category, so 45 to 49. And then, lastly, subpopulation 12, our last subpopulation, is referring to females who are 75 and older. So let's just compare just offhandedly. So let's say for our youngest group of males here, the mean is 8.6, and for our youngest group of females, which would be subpopulation 7, it's 8.433. So it seems like there's a little difference, but it might be smaller. And then for our oldest group, it would be subpopulation 6 for males, so males 75 and older. We can see we've got our cognition summary score as a mean of 5.88. I mean, one of the things that you will notice is that we see cognition decline across age groups for both genders. This is typical as people get older. And then you can see, so we'll compare that with females who are 75 and older, and it's 4.56. So you can see there seems to be quite a big difference. And we will, let's test that difference quickly. So we're going to test the difference, again, using an adjusted wall test. And then in this case, it's very similar to the code we used before. We'll test subpopulation 1 versus subpopulation 7. And then that's the youngest groups. So youngest males is equal to youngest females. And then we're going to test whether the oldest male estimate is equal to the oldest female estimate. So if we look at our youngest two groups, youngest males equal to youngest 7, it looks like using adjusted wall test, that difference is not statistically significant. So that's interesting. And then if we look at our oldest group, it looks like our difference is very significant, right? It's significant at a 99% confidence. So what we've kind of found there is that there does seem to be a different age difference that's happening for different age groups, and it is changing. So one of the interesting things here might be to look into, and what the original paper this example is based on does is look into, well, are there different, are there educational differences that can explain this cognition, or are there region differences that can explain this cognition difference between males and females at different ages, which is interesting. Olivia asks, might you please send a copy of the slides afterwards? And yes, Olivia, I will. I'll upload the slides to the Gateway to Global Aging data on the download page a little later this afternoon after it, so you can follow along with the slides. We'll just add it kind of as the third link here under our recent presentations for the January 9th advanced webinar. So you can certainly have those. We're also recording this webinar, so it'll be made available and it'll be emailed to all the participants tomorrow, and we'll also have a link here on our recent presentations tab. So if there's anything that I'm going over that seems too quick, you could always review it or just send us an email and ask a particular question. That's absolutely fine. All right, so that was kind of part 1, and then we're going to walk through part 2, which will go a little bit quicker because we already know what we're looking at now. But so what we want to do is we want to look at a cross-country analysis, and we're going to use Harmonized CHARLS as we just did, and then let's also use the RAND HRS. The RAND HRS is kind of a simplified, easy-to-use version of the HRS data, which is created by the RAND Corporation. And we used, here at the Gateway to Global Aging Data, we use the RAND HRS as kind of our basis because it's how most researchers use the HRS data. So our research question is going to be, are the gender differences, so those differences that we saw in the Harmonized CHARLS in cognition, are they consistent across countries? So do we see the same gender difference here in the US? We are in the US here with me. Do we see that in the US? And if we do see it, do we see something similar where perhaps for younger people that difference seems smaller or insignificant versus for older people? So our steps are going to be to identify relevant variables in the RAND HRS. We're then going to create a pooled data set with variables from both harmonized data sets, from the Harmonized CHARLS and from the RAND HRS data set. We'll prepare our variables, we're going to apply weights, and then we're going to analyze, again using a mean test, cognition across genders and ages for each country. So the first thing we want to do, I'll just briefly mention, so you might say, I don't have the RAND HRS, how do I get that? And again, I'm going to point you to this downloads page, which is an index of helpful information. So if you wanted to download the RAND HRS data, you do not have to run a data code. You can just download this data directly. And you could follow this link here from downloads. You would just need to log in. You need to register if you haven't registered and log in to the RAND HRS site. And you can download the RAND HRS. They currently just released version O. So we'll be using version O for this example. And then again, you might also want the RAND HRS codebook so that you can tell what's going on. So you can download the codebook here also, which will be helpful for us. All right, so now we've got the RAND HRS. We want to identify relevant variables. And our year of interest, again, is going to be this 2010-2011. And we just picked this example here because it was used in the original paper. But 2010 is wave 10 of the HRS. The HRS has been going on since 92. So our variables are going to be named differently in the RAND HRS. So our measure of cognition is going to be the same measure because the same questions were asked in the RAND HRS and in the in the CHARLS data and in the HRS data. Our gender variable, gender is defined exactly the same. So it's our gender variable is RA gender. Our age identifier in this case is RAGEY, and we have this underscore E, so we can figure out what that is. And then we have our analysis weight. So if we wanted to kind of collect these together, again, I would suggest the easiest place to do this is the concordance tab. So if you go to concordance, we can select RAND HRS. Again, we want to look at 2010, 2011. And we want age at interview, and analysis weight, and gender. So let's do those, and let's say search. You can see here, there's our gender variable, right? Gender seems easy. We've got a couple different weights here. And so you might want to visit the RAND HRS codebook to figure out what those different weights mean. And we could jump to, using the bookmarks, so we could jump to our person level analysis weights. And we're using person level analysis weights here because cognition is most of these studies have household weights and person level weights. But what we're looking at here is cognition, and that's measured something that is individual. So we're using these individual person level analysis weights. So you can see here we've got a couple different person level weights. But this weight here that we want is the one at the beginning, which is WTRESP. So let's go ahead and add this. And again, we're looking, this is wave 10, so our variable name is a little different, but we'll add that in. And then we also need an age variable. And it's interesting because it looks like we have some underscore B's, underscore E's, and some underscore M's. So you could look, you could jump back to the code book. We could also just look on the website. We can go to, we also kind of have a code book view with a little less information though built into the gateway to global aging data. So we can scroll down to our weights, or our ages, I'm sorry. In this case we want ages. So you can see this is the underscore B here refers to age in years at the beginning, and then underscore E is at the end interview. So the RAND HRS produces 3 different ages, and that's because they are capturing age when the interview first started, if the interview took a couple times, and then in the middle of it, well, and then at the end, and then this middle measure is this middle measure is kind of, I think it's the average or the mean of those two if there's a difference. In general, there's not a difference, but there sometimes is because the sampling period of the HRS can be a little longer than other studies. So now that we've kind of figured that out, one of the things you could do if you look at the code book is you could read and you could see that they think that the most comparable, this variable that you should use the most is this _E1. So at the end of the interview is usually what's kind of the best measure. So the RAND-HRS and the documentation suggests that, so we're going to use that one. So we've got the variables that we need, so that's great. And then we can create our additional variables. So we're going to do that. We're going to use this. Well, first we're going to pool our data sets with variables from both harmonized data sets. And we're going to do this using first the use command. And we're going to pull in the variables. You can say we see that we've listed out the variables here from the RAND-HRS, which is R10, TR20, so that wave 10 episodic memory summary score, our gender variable, our age variable, and our weight, and we're using our data set. And so you can see what we're doing here is we're not pulling in the entire data set. You can do that, although often for people who have one of the smaller versions of Stata, the RAND-HRS is a huge file. I can't remember how many thousands of variables, but often people are not able, if you have a smaller version of Stata, you aren't able to pull the entire RAND-HRS into your version of Stata. And so this kind of command right here is quite helpful because we can say, well, in this case, we're only using these 4 variables for the RAND-HRS. So we'll just pull those 4, and that's not going to break anyone's data. And then we're going to append, which is to say we're going to add observations from a different data set below our using data. In this case, would be the RAND-HRS, since we read that in first. So we'll append using hcharles.dta. And we're going to keep these variables as we already specified, right? In our first example from the Harmonized CHARLS. So to do this, let's open up a new Stata window. You could also use your previous window and just say clear all. We're going to say file open, and we can open, not file open. We're going to open our do file editor here. And then in our do file editor, we're going to open part 2, our cross-country analysis for this webinar that we downloaded from our website, from the downloads page. And we need to edit 2 lines here. And we need to edit this line which says where the RAND-HRS folder is. And in this case, I've got the RAND-HRS stored on my C drive here. And here's my code, so I'll just copy that in. That's where's that stored. And we know that our harmonized CHARLS data, we've saved our computer, right? And we know that that is in CHARLS, and we call that file inside of the C drive CHARLS directory harmonized. We'll get rid of that last pipe there. All right, so once we've edited those 2 lines, then we can go ahead and run this. And you can run it just by saying execute.do. So the first thing is, as we said, we're going to read in just these 4 variables from the RAND-HRS. If you have the variable window open here on Stata, you can see we read in just these 4 variables. So RA gender, R10, our age variable. And the other thing that I did is I created a country variable. And this can be helpful because once we start to combine these 2, we want to make sure that we know which is the US and which is from CHARLS, which observations are from each. And so we want to kind of create an identifier. And I do this, I make a variable called country. And for the US here, I give it this number, which is 840, and that is the ISO country code. I tend to store things in numeric values. It makes things easier. So I just use 840 for the US here. It looks like Li Tian has a question. My Stata reports RAND-HRS o.dta is not Stata format. There could be a couple questions with that. In the last, I think, in moving from version 12 to 13 and 13 to 14 of Stata, you can see I'm using 13 in Stata. They've also changed their dataset format. So if the RAND-HRS is distributing data that was created in 13, you might not be able to read it with 12. And similarly, if it was created in 14, I couldn't read it in 13. This is just kind of an unfortunate thing about Stata versioning currently. Litan, you're welcome to let me know which version of Stata you're using, and that might help us solve this problem. But I would also just suggest you contact the RAIN-HRS help desk. They're extremely helpful because it might just mean that you need an older version of that RAIN-HRS data. That's what I would guess. But yeah, so you see you're using Stata 12, and I bet that they use Stata 13 for their version. So I would just send them an email, and hopefully they can provide you with an older version. That's not hard to do. Or if you have maybe a friend or a colleague who has version 13 or 14, you can always read in earlier versions. You just can't read in future versions. So they could read in that version and then just save it for you. It's called save old is the command in Stata. But feel free to just follow along here on the screen. So we're going to queue through to our next step here, and we're going to read in the Harmonized CHARLS variables. And again, we're going to do this with this append command. So we're going to say append using our Harmonized CHARLS data, and we're going to keep the 4 variables which we looked at in part 1. And then there's also a slight command on here which is at the end, which is gen append. And that just creates in a variable called append, which either has a 0 or 1 for whether the data is appending. And we're going to use that to identify the observations which are from Charles. So in this case, we're going to say we're going to replace our country variable is equal to 156, and that's the ISO country code for China, if the append is equal to 1. And then we can drop that append variable. And just quickly, we'll tab our country variables and we'll give it some labels. So you can see that currently we've got 21,000 observations from China and 37,000 observations from the US. These are for all waves. So both the RAIN-HRS and the Harmonized CHARLS include all waves of the current data. So this doesn't just refer to respondents who were interviewed in the 2010-2011. Yao Zhao, apologies if I mispronounced that name, is asking, is there any R code for this data similar as data code? That's a question we've gotten a couple times, and currently there is not. If you remember when I pulled up the data creation code, it was quite long. So we don't have creation code that's long. But all of these data sets can pretty easily be transferred if you have a program like stat transfer to different data sets. So there's nothing that's very complicated in the code that I provided today. So it'd be fairly similar to do a similar thing in R, although I didn't type it out here before this webinar because really we focus on Stata. But it'd be quite easy to write in R if you just transfer the data set after you ran it in Stata. So I hope that helps. We are also a fan of R. We like that it's open source and is free compared to Stata. Stata just happens to be used by many economists. So that's kind of where we began this project. All right. So now that we've got our pooled data set, and you can see here, so we've got these variables. One of the things that you might notice is that our variables names are different, right? So because we're using this year number in the variable name, our RAIN-HRS variables start with R10, and our Harmonized CHARLS variables start with R1. And we want them to be the same to do this analysis. So in the next step, we're going to adjust for differing wave numbers in variable names, and we're going to do that with a code. This is an example code here for the cognition variable. So we're going to make a variable called R, respondent level, and instead of a wave number, we're going to put a year number. So I'm going to put 2010 as sort of a substitute for 2010, 2011 here. Cognition is equal to, and it's going to be equal to the R10 TR20 variable if they're from the US, right? If country code is equal to 840, and then we're going to replace that value. We're going to replace it with R1, so wave 1 of Charles, right? This R1 TR20. It is from the Harmonized CHARLS, and if that country code is equal to 156. So we're going to do that, and we'll do that for a number of variables, right? We'll do that for our cognition variable, for our age variable, and for our weight variable. We kind of do exactly the same code. You can see that here in our do file editor. So these are just exactly the same code. Replace weight here. And then we can check our analysis variables just to see that they look good. So we've got, so what we'll use here is RA gender, because that was the same. That's not weight specific. It's the same across both studies. Now we have this R 2010 cognition, R 2010 age in years, and our weight variable. So that looks great. The next thing that we need to do is we need to create our age categories again. And this can be a little tricky between studies, so we might want to go back to our Surveys at a Glance tab on the Gateway to Global Aging to see what kind of ages can we compare between these two studies, because they might have looked at different ages. So if we go to Surveys at a Glance, and then Study Overview again, so we can see that the HRS, people who were age eligible started at 51, which is it's different in Charles than at 45, so we should probably adjust for that. And even though both include younger spouses, so you might be saying, well, why shouldn't we include spouses? And you can, but it's not a representative sample of spouses. So spouses are often given a 0 weight if they are age ineligible. So it's often easiest just to make sure that you are looking, if you're looking at specific ages, to make sure that they are within the sampling age eligibility for a respondent. And so we're going to do that. And so we're going to make our age categories here, as you can see with this egen command. We're going to make a variable called R 2010 age category, and we're going to cut it at, so we'll start at 51. So we'll do 51 to 54 will be our youngest group, and then from then we'll do 55 to 59, 60 to 64, 65 to 69 to make our age categories that way. So we jump back to Stata and we queue through to the next stage. So you can see that we can tab it, and we've got our age categories there. So everyone who is 75 and older then is in this category. And so then we can compare. So this is across both surveys, right? Because we're using our R 2010 age in years. So now we've got our prepared additional variables, so we're good there. And now we're ready just to kind of finish this. The last step is to apply our weights. So we're going to again use the svyset command. And we're going to do this slightly differently. So you might recall, so these are two different weights which are made by two different studies. In this case, they are both probability weights. So we're still going to, and we combine them into this one variable called weight. We combine their values into one variable called weight. But we're going to use here our strata command, and we're going to set the strata by country. And so what that tells Stata is that these two weights are specific to the different countries. So to keep that in mind. And in general, if you are trying to combine two different weights from two different studies, this is kind of how this is done. You can also still then go in and specify complex sampling design by using kind of second stage or third stage sampling if it's available for both studies. And it is available for the RAIN-HRS, but it's not for Charles. So in this case, we're just going to, we know that we have to watch out about our standard errors that are produced, but we are just going to look at just strata for country. So if we go back to our Stata window, we can queue through and we can set our complex sampling design. There. We also use this command called svydes, which is often a little bit helpful right after you use svyset to be able to see which kind of how everything was set. So we can see here that we have two strata, and we see the number of units inside each of the strata. So that can be helpful. All right. And then for our last step, we just want to analyze cognition across genders and ages for each country. So we're first going to estimate mean cognition for each country, gender, age group, right? So we'll have, I think in this case, if we have 5 age groups and 2 genders and 2 countries, then we'll have that many that many different categories. So we're going to say, we're going to use SVY, which is going to recall our weighting that we already entered using svyset. We're going to estimate the mean of our 2010 cognition measure, which is the summary measure of episodic memory. And we're going to do that over these three categories now. So jumping back into Stata, if we type Q, you can see that looking, first here, I just compare it over country. So looking at two different countries, you can see that the U.S. Respondents in the U.S. tend to score much higher on this episodic memory score. I would be extremely hesitant to infer anything between Chinese respondents and U.S. respondents based on this. It could be that the words in Mandarin are different, or there's something different going on. This would be something that's very hard to tell across countries. But what we want to really do is we want to just say, hey, so I noticed this kind of difference inside of the Chinese population between genders and ages. Is that similar to a kind of difference that I see between genders and ages in the United States? So first here, we just look at everyone who are male and female, not using our age categories. And then if you tab through one more time, then we're going to get our 20 different categories, right? And so we've got our 5 different age groups, our 2 different genders, and our 2 different countries. So we're going to get 20 subpopulations. And then we want to compare those subpopulations. Because we've changed our age categories a little bit, we're going to look at the Chinese population again. So we're going to compare our youngest Chinese population, which is males, in this case, who are 51 to 54, compared to Chinese females who are 51 to 54. You remember in part 1, we compared Chinese males who were 45 to 49 to females of the same age. We found that there was not a statistically significant difference. So we want to make sure that's still true. And then we want to compare that to if there's a difference that we're seeing for the US. So to do that, we can test the difference for the youngest group in China by comparing subpop 1 and subpop 6. We can do a wall test if those estimates are different. And then we're going to test that difference for the youngest group in the US, again, using a wall test, and it's subpopulation 11 and subpopulation 16. So if we queue through here, let's test for the difference for the youngest age group in China. Again, we can see based on our F-score from the adjusted wall test, it seems like there is not a statistically significant difference. As we found for that youngest age group of 45 to 49, it holds true for 51 and 54. We're still not seeing a significant gap in cognition between males and females. And then if we look in the US, so it looks like actually for the US, for the youngest age groups in the US, you do also see a statistically significant difference. And if we go back again here, we're comparing subpopulation 11 and 16. So the average or the estimate for the mean cognition for the US population for youngest males is 10.44, and for females, which would be 16, it's for 16 would be 11.239. Make sure that's right. Yep. So you can see in this case, actually females are performing higher cognitively in this age group than males. And so then let's look, so we're seeing a statistically significant effect in the opposite direction. And then we're going to look across the oldest age group. So the oldest age group in China, and then we're going to test the difference for the oldest age group in the US. We can do that by tabbing Q through here. So when we look at the oldest age group in China, and this is as we saw before, right? We haven't changed our definition of the oldest old. You can see that there is a statistically significant difference as we saw before. And for the US, you can see that it also is a statistically significant difference. You might want to refer though back to our actual mean estimates and note that the statistically significant difference is in the other direction in the US than in China for our oldest of the old, which was suggested by what we saw in the youngest of the youngest. So that wraps up our 2 examples of harmonized analysis. I'd be happy. I'll stay on and answer any questions. Really, today we kind of wanted to give you an example of some of the barriers to using these data sets and how they're helped by using harmonized data sets and the Gateway to Global Aging data. So, using the Gateway to Global Aging data, we were able to, download and create our harmonized data sets. We could search for the right variables using the concordance. We could use our surveys at a glance to compare things. Also mention a couple other things that we didn't talk about. We also have graphs. And using these graphs, we could have actually done a little bit of this work just using the graphs. So we could have compared HRS and Charles in 2010 with our summary measure of cognition using a graph. You can see we have a histogram here, or we can get a table, and we can see some of the things. And these graphs don't allow you to go quite as far as we did into breaking it down by age groups or gender groups inside of countries. But you can start to see some of those things suggested here in the graphs. And then if you wanted to look for more information about people who have done research using cognition in both of these studies, our publications tab is a great place to go through. So for instance, you could search for the HRS. We can say we're interested in the HRS and Charles, and our topic that we're interested in here is cognition. And in this case, we get a number of papers. We get 341 looking at cognition in the HRS and Charles, and these can be exported. And it's a good place to kind of get an idea of what research has already been done out there. As with all things, on our website, we always are happy to answer questions. If you have any questions about using harmonized data or using the Gateway to Global Aging data, or getting started even using any of these data sets, and you can do that by writing us at help@g2aging.org. We always try to answer emails within 24 hours. We have a team of programmers programmers and researchers who are happy to answer your question. All right, so I'll just be answering questions for the next little while, as long as people have questions and are hanging out. Thank you all for joining us. There'll also be I think when this closes, and you'll also get an email tomorrow, there's a survey. We'd appreciate if you would fill it out, let us know. This is the first advanced webinar we've done, so we want to know if this has been helpful, or if there's things we could improve, or any other topics you would like to see. So again, thank you all.